And talking about accountability, let's bring on our guest. His name is T Prashant Reddy. He's a lawyer and co-author of the book, The Truth Pill, The Myth of Drug Regulation in India. The book that he has written along with his co-author exposes deep flaws and gaps in India's drug regulatory system, revealing how weak oversight and has compromised public safety. It calls for urgent reforms to ensure stricter control and accountability in the pharmaceutical industry. So really, we couldn't think of a better person to actually speak to us as 9 days have passed on this entire unfolding story on cough syrups. Mr. Reddy, thank you so much for being with us and taking out the time. I first want to start... Pleasure, sir. I want to start by understanding, you know, we're talking on day 9 since the first incident was reported here. We've seen, I just laid out the list of actions which have been taken so far. We are seeing some low-ranking officers arrested, suspended, one doctor arrested. We are looking at some companies being banned, some pharmaceutical, one in fact being picked up and arrested as well. We are also looking at a blame game of sorts between center and state on who's responsible. In your opinion, where does the buck stop in a case like this? Who is responsible for all these deaths that we've seen so far related to cough syrups?
Thank you for asking that question. That's a very pertinent question. And the facts in this case, in fact, highlight very well the convoluted structure of drug regulation in India, because the tragedy has taken place in Madhya Pradesh, but the cough syrups were manufactured in Tamil Nadu. Now, the way Indian law is structured, the central government only sets standards for quality, and they take care of imports and the approval of new drugs, that is, validation of safety and efficacy of drugs. But the manufacturing license, which is the crucial component of quality control, is issued by individual state drug controllers, which means that the quality of drugs manufactured in India can vary widely across states. There are states who are better equipped laboratories, they have better resources generally because they're doing, they have better budgets. So those states may have better drug quality control, whereas a lot of states where India's drugs are actually manufactured, like Himachal Pradesh and Uttarakhand, have very weak drug control, local state drug control regulators. And this is the complexity, the heart of the problem in Indian drug regulation. You have one market for drugs, that is a drug manufactured in Himachal Pradesh can easily be sold across the country. But when it comes to regulation, you have this fragmented system of regulation where you have regulators, each state regulator and each union territory regulator looking at their own issues. So there are a lot of cracks in the system and a lot of stuff falls through because there isn't enough information sharing between different state drug controllers. For example, something as simple as having a centralized database. We don't have that. You want to check inspection reports, you want to check drug samples which have failed in government labs. There isn't a centralized laboratory. You can't find it.
Yeah. In your book that you wrote back in 22, you have argued that India's regulation on drugs is not just flawed, it's opaque, and it's also under-resourced. So are we to understand from this that this is not just a problem of implementation, but this is a problem of regulation as well? We need stricter laws and perhaps an overhauling of who is putting the guardrails when it gets to ensuring that bad medicines, contaminated, spurious, etc., are not entering the markets?
Yes, exactly. I mean, a lot of times after these tragedies, the focus is on issues like corruption and lack of, say, drug inspectors. But the argument that we were trying to make in that book, and which still stands true today, is that we have a problem with the way the system is designed. It is outdated. It was designed in 1940, where the concepts of quality control and regulation were very, very different from what we have today. And there have been attempts by the government to try and overhaul this law. For example, in 2017 or 18, I think when Mr. Jaitley was still a cabinet minister and alive, He was the one who had pushed for the government to enact a new law, because what they were otherwise doing was they were putting band-aids on this old 1940s law. So in 2022, they did introduce a new bill, which was very badly drafted. It was basically a copy of the old bill. There was a lot of opposition to that. And after that, the government just dropped the ball. The need of the hour today is we need to overhaul the entire regulatory framework for drugs and to some extent nutraceuticals, and design a new system keeping in mind the federal structure of the country and the health needs of the Indian people.
You talk about the bill, but there was a revision, right? The Jan Vishwas bill that has been brought in by the government. What do you make of that?
Yeah, the Jan Vishwas bill was a very, very bad idea. It was it amended only one provision of the Drugs and Cosmetics Act. Basically, it decriminalized the manufacture of substandard drugs, which basically means if a drug fails to meet quality specifications regarding the active ingredient that it has, it fails to dissolve, or if it fails a sterility test, the law used to mandate imprisonment of 2 years and a fine of 20,000. So the Jan Vishwas bill basically said that we will make it a compoundable offense, for the first offense. That is, the first time you can get away by just paying a fine of 20,000 without having to face any criminal consequences in terms of imprisonment, which was a very bad idea. I mean, we need to be regulating the industry more, not less. But yeah, unfortunately, that law was passed by Parliament in 2023.
Right. I just want to get an understanding from you beyond just the present case of cough syrups. And we looked at some data, some of which has been pointed out in your book as well. 2020, in Jammu and Kashmir, I believe 11 children had died, again that time due to cough syrups. In 2022, we had the Gambia tragedy where 66 children had died. Uzbekistan also happened in 2022. In 2024, we dug up some data to find out that in the state of Karnataka, women who had just had cesarean operations were given some substandard IV drips that led to some deaths as well. Where I'm getting with all this data is the fact that in 2020, the company was in Himachal. In 22, the companies were in Noida and Haryana. In 24, it was a company called Paschim Banga. Now, in 2025, we're looking at companies based out of Tamil Nadu and other places. This is not just a particular state problem. We are looking at a systemic failure to keep a check on what enters the market. Is that correct?
Yes, that's very true. There's a systemic failure across the country. There needs to be a complete overhaul. And that overhaul is very, very difficult because the pharma industry at the state level is deeply enmeshed in state politics. You've got political parties, local politicians with stakes in pharma companies. They get funded by pharma industries, especially the small and medium sector, which is the most influential. So any attempt to try and reform this will require political parties to take this up at a national level. And we're unlikely to see that, unfortunately, because even after these tragedies are happening, if you notice, political party leaders are not speaking up because everyone's got skeletons in their closet, right? So it's not become a political issue this time. Even when it happened in Gambia, the government just washed its hands off the entire tragedy. And now we are facing the consequences after ignoring the export markets.
But why do you say that you don't see it getting any better? You wrote your book back in 22. Since then, there are a number of instances that have happened. This one surely doesn't make a case for any kind of betterment. But have you sensed any kind of reforms that have taken place?
There's absolutely nothing. Like, they made it worse, right? With the Jan Vishwas Act, they made it worse. And beyond that, we are just not seeing any reform. So we keep reading in the newspaper where the national drug regulator, the CDSCO, keeps claiming that, oh, we went and did joint inspections with state regulators. We have shut down so many plants, etc., etc. But we can't find the name of one single plant mentioned in the newspaper. Similarly, with cough syrups, after the tragedies in Gambia, Uzbekistan, the Ministry of Commerce, under whom drug regulation does not fall, they invoked a trade law to set up a testing requirement for export, mandatory testing requirement. That so all the export consignments were being tested in government labs, and it was the press reported that about 100 samples had failed testing in those government labs, cough syrups. So we knew that there was a problem. They did not release the name of a single cough syrup into the general public, despite the fact that those same manufacturers who export also very likely sell domestically in India. So this was just a matter of time. The writing was on the wall. We were just not surprised. Dinesh and me, we were just not surprised when this happened.
So help me understand this. What will it take to ensure that this is the last of the deaths that we are seeing because of contamination of drugs or spurious drugs, etc., coming into the market? What do you think? What's the solution here?
It will take an act of God, honestly, given the way politics is running in this country right now. But if the optimist in me were to talk, I would say like a very low-hanging fruit, something that even the courts can do if they're interested, is to order the state and national regulators to make available all test reports, all inspection reports that they have done. So, for example, that if we knew how many times this particular facility was inspected in the past and who did the inspections, we would then know how to fix accountability. And the moment drug inspectors know that their inspection reports are going to be made public with their name on it, they will start taking their job more seriously, because they know when a tragedy like this happens, it is going to be their head on the line. So greater transparency, as you know, that saying goes, transparency is sunlight is the best disinfectant. The only way I see things changing radically is if we infuse a large dose of transparency. And that is, again, very, very difficult in today's India.
All right, but that's a good suggestion, and we hope that people are taking due notice of this. I also want to understand this from you. Mr. Reddy, India prides itself in being an affordable market when it comes to drugs compared to a lot of countries out there. We pride ourselves in having more penetration of medical care, etc. But this story like this, when cough syrup deaths, IV deaths, etc. happen, we go back and question if brands are what we are to go for. In this fight between branded drugs versus generics, where do you really stand?
I think most of them are bad. I mean, you actually can't tell, because a lot of these so-called branded guys, like the big, really big top 10 big guys in India in the pharma industry, a lot of them engage contract manufacturers. So if you look at the fine print on the packaging, it may have the label of the big brand, but the manufacturing facility is actually somebody else's, because these guys use their own facilities mainly for the export market. For the Indian market, they depend on contract manufacturers. So the fact that something is coming from a branded facility is no guarantee in India, because if you read US FDA inspection reports of the biggest brand facilities in India, that's a different horror story on sanitation standards and data fabrication, et cetera, et cetera. So there really isn't any guarantee. And you ask doctors, even they don't know. I mean, this everybody is cruising on prayers and luck. There's no concrete way to pin down quality in India right now.
Mr. Reddy, you paint a very, very sorry picture. Is there some hope? Is there something that you want to leave us with in terms of what we as citizens can do, what we can ask our policymakers to do? One change, perhaps, that we can bring. We've been bringing a checklist of sorts to tell people, read the ingredients, look out for this ingredient. But even if it's the right ingredient, you don't know if it's the quality, how substandard, etc. it is. Is there anything that you want to leave us with on a positive note? Because this is It's a serious, serious problem.
Yeah, I mean, see, it depends, like some certain kinds of medications which are more sensitive to quality issues. I would say trust your doctor. I know like Indians are very cynical about their doctors today, but for a lot of, like, for example, nervous conditions, neurological conditions, thyroid and all, where the medicine is very sensitive, trust your doctor's judgment because doctors are constantly prescribing drugs and they get feedback from their patients. So even if it's a little bit more expensive, it's okay. Trust your doctor on that count. For stuff like cough syrup and all, just try and avoid it because even doctors say that a lot of doctors disagree with the fact that cough syrups are even required.
Yeah.
Beyond that, there really isn't much for me to add unless you want to, petition the health minister and ask him to do something about changing drug regulation laws in India. Uh, that's as far as I can recommend.
All right, Mr. Reddy, if the health minister was listening to you right now, what would be your one piece of advice to him?
I would say make everything transparent, make inspection reports transparent. The government does a lot of testing, make those test reports public from state labs and government labs. Government does a lot of procurement itself. And it does testing on those procurements. Those reports should be available because this is not a problem limited to smaller manufacturers and small cities. Last week, AIMS, the All India Institute of Medical Sciences in Delhi, where a lot of VIPs get treated, they put out a press release saying that intravenous fluids that they had procured, they detected contaminated fungus in them. It's reported in the news. And they then banned the manufacturer. Now, when something like that, something as serious as this is detected in a manufacturing facility in a premier government hospital, alarm
Yeah.
bells should have rung across the world, across the country, to withdraw other stocks manufactured by this company. That never happened. So these questions need to be asked of the government. Why are they not withdrawing these stocks when they detect that there's something contaminated? So there's no silver bullet. We need a
Yeah.
complete system overall.
There is no pill to sort out this problem, really. One has
Yep.
to start by just bringing out, making it more transparent, bringing it accountability, and I think that's what you're referring to. Mr. Reddy, thank you so much for joining us.